Hello, I'm Mabel Zhang, and you're watching HealthDay's conference coverage exploring research with the world's leading medical professionals. The American Psychiatric Association's 2023 annual meeting followed the theme Innovate, Collaborate, Motivate, charting the future of mental health. I'm joined now today by the president of the American Psychiatric Association, Dr. Rebecca Brendel, who's here to share more about this year's new and exciting research. Thank you so much for joining me, Dr. Brendel.
Thanks for having me.
There were many significant studies presented during the week. Which stood out as potentially practice-changing for a physician in everyday practice?
What really stood out, even more than all the cutting-edge therapeutics and the way we're changing lives through mental health treatment, is really the research and the innovation around how we deliver mental health care and how we reach every American in need of care and treatment in new and innovative ways, starting with digital mental health and continuing to the presentations we had about APA's roadmap for the future and how we can leverage psychiatry at only 6% of the mental health workforce to really lead in providing high quality, evidence-based, accessible, and affordable care.
Of great significance was the results of the annual public opinion poll. It measured the pandemic's impact on mental health. Though this year's poll showed a lower mental health impact than during the pandemic, it was still higher than before 2020. What's your take on the data, and what is it saying about the current state of the mental health of adults and children?
Well, we shouldn't be surprised that the pandemic continues to have lingering effects on our mental health. Even though we're now a couple weeks out of the public health emergency, and it's such a relief to not be at imminent risk of contracting a deadly virus any longer, we do know that in the 3 years of the public health emergency, every aspect of our lives was disrupted. All our social institutions, our relationships, our patterns of behavior, even where and how we work. And so those effects are things that are going to stay with us and require us to really go forward thinking deliberately about how we rebuild, how we reimagine what it means to be socially connected, how we get back into being the social beings that we are and creating the connections and supports that keep us mentally healthy.
And how would you describe the mental health of adults and children currently?
Well, all Americans are more anxious than they were before the pandemic, yet we see that those numbers are subsiding. And that's the good news. The good news, we've set up ways for Americans in mental health crisis to talk to a licensed mental health counselor rapidly through 988, just like for any medical emergency. We've begun to really roll out and expand upon digital mental health access to mental health treatment through telemental health in ways that were really not widely available before the pandemic. And we are talking about mental health. Most importantly, it's on the public agenda, and we're talking about our mental health just like we talk about our physical health, which is such a huge development and something that gives us the opportunity to be coming up with new and collaborative solutions.
You mentioned rebuilding. How can psychiatrists transition their practices to support those impacted by the effects of the pandemic?
One of the things that APA has been really successful in this year is working on the state and federal level to get funding for innovative mental health care models like the collaborative care model, which works with primary care and pediatrics practices to be able to use a single psychiatrist to oversee the treatment of as many as 20 patients in the time it might be to see one. And that's using an embedded behavioral health case manager, care manager in a primary care or pediatrics practice. So those are some of the things that we need to do, expanding the reach of each mental health professional to be able to treat more patients.
Well, according to this year's poll, over half of parents say they are concerned about their children's use of technology and the mental state associated with that. Additionally, 31% of the APA's poll respondents reported having difficulty scheduling appointments for their children with mental health professionals. How can psychiatrists overcome these barriers? And how should this new data inform them, influence them in the care of adults and children in their practice?
Well, there's really two parts to your question and to the solution. The first one is about how we engage with social media, which really was a lifeline early on in the pandemic, but we know in the long term does not substitute for in-person contact and connection that's reciprocal, where we get feedback in the moment and allows us to engage with each other around things that are happening in real life. So building our relationships and finding opportunities for that, having families come together, limiting screen time, and being really deliberate about it as something that's good for everybody's health. So that's one thing, is changing our behavior. But the other piece of that is really making mental health care available to Americans who are waiting for it now and really asking for it. And some of that is going to be at the point of care, but some of that is also building on our mental wellness, bringing, for example, as the APA Foundation is doing, training to school personnel to be able to support the healthy development and wellness of every school child, while also recognizing children who are in need of more help or more assistance and really aren't responding. Other opportunities, other community institutions, religious institutions, sports teams, clubs, after-school activities. Everywhere we find ourselves are the places that we need to be focusing on wellness and the tools to identify who needs help and to get it early.
There have been a lot of encouraging moves in the field of psychiatry due to the pandemic. That started a lot of work towards positive change. But what would you say is the greatest challenge we face today in the field of psychiatry?
The greatest challenge really is to harness this innovation and prepare ourselves with the workforce that we have and the workforce that we're going to develop to really meet Americans where they are, and to make sure that once and for all we recognize that mental health is part of overall health and needs the same attention and resources as any other kind of healthcare.
Thank you, Dr. Brendel, the president of the American Psychiatric Association. And I'm Mabel Zhang. You've been watching HealthDay's conference coverage.